Hello, everyone. Welcome. Glad to see you coming into the room today. I am Ryan Stubbs. I'm the Senior Director of Research at the National Assembly of State Arts Agencies. And yes, the acronym is pronounced NASA, just like the space agency. And before we get started today, and as we all enter the virtual room, I wanted to provide a few housekeeping items and ask a couple of questions to help us enter this space together. I know we're all pulled in many directions, especially while we're working online. So in the spirit of good health, I'd offer us a chance to just take a deep breath and bring our attention to today's program. So we'll start with a poll to give us a little better perspective on where we're all coming from today in terms of our jobs, affiliations, or backgrounds. So thanks for sharing that, Eric. And thanks to Eric Giles, NASA's Learning Services Director, for his assistance with today's webinar. And I'd also like to offer a land acknowledgement. Please join me in a moment of reflection to honor Indigenous peoples and acknowledge the taking of their lands and their lives. Let us commit to responsible stewardship of the land and respect of the First Nations, remain part of the past, present, and future of places we call home. Let us commit to developing relationships with Indigenous peoples and centering their voices to inform action moving forward, advancing equity in service to them. Today, I'm coming to you from Denver, Colorado, which is the traditional land of the Ute, Cheyenne, and Arapaho peoples. And NASA is based in Washington, D.C., the traditional lands of the Piscataway and Anacostan peoples. So in the chat, feel free to tell us where you're physically coming from today, to acknowledge native lands if you're comfortable in doing so, and perhaps one other icebreaker in the chat. Let us know what you hope to learn today. And throughout, we encourage a lively chat space, and we'll be monitoring it for questions and issues during the course of today's presentation. And with that, I will hand things over to NASA's President and CEO, Pam Brown.
Thanks so much, Ryan. And hi, everyone. Thanks so much for joining us today. NASA is happy to be hosting this webinar in collaboration with the National League of Cities to discuss how public agencies are leveraging partnerships to do innovative work in the arts and health space. An increasing number of state arts agencies and local arts agencies are pursuing and developing programs to use the power of art, right, and artistic practices to improve public health and community well-being. And so today, we'll be hearing more about how the arts can be a strategy to improve public health and how arts administrators, practitioners, and artists have forged partnerships to implement arts and health programs at both the state and local levels. We also know that this type of collaborative cross-sector work is important at the federal level. The administration's recent executive order on the arts, humanities, and museums and library services foregrounds the value that cultural agencies have in improving the nation's health and well-being. However, cultural agencies at any level of government cannot do this work alone. The executive order also directs all executive departments and White House policy councils, including agencies like the Department of Health and Human Services, the Department of Commerce, and the Department of Transportation, to work with the NEA, NEH, and IMLS to advance the cultural vitality of the United States. So given this particular backdrop, cross-sector, or what we might call arts and work, could not be more relevant. And we can look to state arts agencies as innovators in cross-sector programming. We're excited to have this conversation and shared learning experience with all of you today as we hear more about arts and health work and with partnerships occurring in Rhode Island. And speaking of partnerships, we are thrilled that the National League of Cities is engaged in arts and health programming, and that we've been able to collaborate with them to get more information about the power of the arts to improve community well-being to more local leaders across the country. And so it's with pleasure that I hand the gavel or the program over to Georgia Gempler, Senior Program Specialist for Health and Wellness at the National League of Cities, to tell you more about our agenda for this afternoon. Georgia, welcome.
Thank you. Thanks so much, Pam. So like Pam said, I am Georgia Gempler, Senior Program Specialist of Health and Wellness with the National League of Cities. And the National League of Cities is an organization comprised of city, town, and village leaders that are focused on improving the quality of life for their current and future constituents. At NLC, we know that arts are essential to community health and well-being, and we're currently working with a cohort of 9 cities across the country on an arts and health collaboration, building partnership muscles locally between the arts, local government, and health sectors in order to achieve community health and improved well-being. We're looking to create a more formidable way of practicing partnership within government for community health and well-being, and that starts with the arts. The City of Providence is a member of this cohort, and we are so thrilled to highlight their leadership in this work today. I would like to briefly introduce our panel before we get started. Our moderator today is Dr. Tasha Golden, who is Director of Research at Johns Hopkins University, Director for the International Arts and Mind Lab. Lynne McCormack, who is Executive Director of the Rhode Island State Council on the Arts. Steven Boudreau, who is the Chief Administrative Officer for Rhode Island Department of Health and the co-chair of Rhode Island Arts and Health. Anisa Raoof, who is the Grant Management Fellow and the Arts and Health Coordinator at the Rhode Island State Council on the Arts, and also the co-chair of the Rhode Island Arts and Health, oh my goodness, I apologize, Rhode Island Art Health Initiative. Gina Rodríguez-Drix, who is Deputy Director for the Department of Art, Culture, and Tourism at the City of Providence, and Valerie Tutson, who is an artist and a founding member and Executive Director of the Rhode Island Black Storytellers, Festival Director of Funda Fest, and, which is an annual celebration of Black storytelling. So today we will begin by hearing from Val Tutson with some examples of the arts and health well-being work that's being done in Rhode Island. Then we'll hear from our moderator, Dr. Tasha Golden, who will provide more framing for the connections between the arts and health. And then we'll hear from our panel of folks in Rhode Island about how they partnered to achieve their innovative programming and lessons learned about effective arts and health partnerships at the government level. Our final 15 minutes today will be for Q&A, but if you have questions at any point today, please put them in the chat and we will call our attention back to them at the end of our session. With that, I will hand off to Tasha.
Hello, everyone. Thank you so much. I have a, I am going to tell you just a little bit to frame our conversation today, and then I am going to toss it off to Valerie in just a minute. So you have to put up with me before you hear from her delightful brilliance, but we will get to her quickly. I'm going to share my screen here to share some slides with you all. Can somebody give me a nod just so I can make sure you can see this okay? Thank you. For those of you I can see. Like she said, my name is Tasha Golden. I direct research for the International Arts and Mind Lab at Johns Hopkins University School of Medicine. But I thought that I would start here today for just a minute, because every day I get to bridge the fields of public health and the arts as a health professional and as a researcher, but I also bridge those fields personally as both an artist and a public health scientist. My first career, I was a touring singer-songwriter for a lot of years, and I'm in public health now because of what I saw in that role, which was that hundreds of people all over the world shared really personal stories with me after shows, often telling me that I was the first person they'd ever told about histories of abuse or experiences with mental illness or suicide ideation. And that means they'd never told a doctor or a therapist, not even a spouse or partner, but they were telling me, like a stranger and a singer in a music venue. And I saw a similar thing when I founded Project Uncaged, which is a trauma-informed creative writing program for incarcerated girls. And it was quickly obvious that girls shared really different information in their poems and in their songs than they shared in questionnaires or even in conversations. So clearly there were experiences and insights that only emerged via the arts. And I couldn't stop wondering what that fact means for our health, for healthcare, for public health. And I was asking questions like, what do we not know about a population because they're unable or unwilling to share experiences in the ways that we might expect or demand of them? What is it, how is what we don't know or can't share affecting us and our communities, our decisions, our services? And if we consider that humans obviously evolved to engage with art, we're still doing it, after millions of years, it must do something for us. So how does it affect our health and how could it improve our health practices? One answer to that question is lies in the World Health Organization's definition of health. In 1946, they said that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. But over 75 years later, most health conversations, like research policy practices, are still aimed pretty narrowly at that absence of disease and harm. And that's so important, but there is a whole other half of health that we rarely talk about in our public health and community health spaces, and that is well-being. When you ask people what well-being is, like if we assume that well-being is more than just the absence of disease, then what the heck is it? If you ask people this question, the answers you get tend to fall under the broad umbrella of arts and culture, like things like being able to find and create meaning, connection, purpose, belonging, celebration, pleasure, learning, awe. So basically, without considering arts and culture, we cannot meet the charge of supporting health in full. And that's a basic premise in my work in here today. The arts can both address the absence of disease and support well-being. And while you might be able to do some great absence work without the arts, it'll be limited, and you're probably going to get nowhere with this half of health over here, the presence of well-being. To get at this work, I usually focus on 4 big ways the arts play essential roles in public health. My framework here on the right echoes the social ecological model that you see on the left. It's going to be familiar to our folks here that are in public and community health. And we use this left side model to recognize that our contexts determine our health. Our health is about much more than individual genetics or biologies or behaviors. If we really want to move the needle on health and health equity, we have to shift these outer levels of the model. And doing that requires innovation, creativity. It requires a lot more voices and perspectives. Basically, it requires art, and it requires art working at multiple domains of impacts. So on the right, you can see 4 of those domains. Obviously, the levels affect and interact with each other a lot. That's why the arrows are there. But running through them separately is a way for us to dive in. And this first one is probably the most obvious. Like when people think of arts and health as a combination, they usually think of direct health benefits, like what people might get from art or music therapy. And of course, there are a lot of direct benefits from the arts, including what we listen to or watch or practice in our homes and communities. And this slide shows just a few examples from studies about how the arts can support health. Basically, as a domain of impact, direct benefits is a big and intuitive place to start, and it's just one piece of the puzzle. We also know that art can improve health data. I already mentioned this a bit in my background, but we know people share and also hear and understand different things via the arts than other forms of communication. I also published an article earlier this year, and we found that the arts-based methods we used in our health research were more trauma-informed and more culturally responsive than the surveys that had been administered. The arts can improve our knowledge and our practices when it comes to public and community health. This is a really intuitive partnership. Like public health is long looked to art and artists to help with communication. Sometimes we're just not very good at it ourselves. We know that stories and visuals are often more memorable and shareable than traditional reports and infographics, which can increase relevance and interest and understanding. We saw that with the graphic novel that came out of this Rhode Island initiative. We also know that public art can attract press coverage. The Project Uncaged program that I mentioned became a Sunday feature story in our city's paper that was picked up by the AP. And as a result, girls' concerns and their experiences were shared with an incredibly wide audience. And that kind of attention can drive interest and then civic engagement. And of course, artists are often trusted and valued by their communities, which means they can just be better messengers and find ways to increase resonance and increase interest. And then for centuries, of course, art's been at the forefront of social movements, of political change, of cultural change. This slide isn't at all comprehensive, but we know that art can elevate and humanize populations and issues. It can help shift perspectives, shift stigma and perceived norms. And in general, if we want policy change, if we want to shift those norms and narratives, that's going to require people to be aware of those things, to feel a sense of connection and concern about it. It's going to require some provocation, some pathos, some amplification, sustained effort, and we can get all of that via the arts and via partnerships with the arts. I like to share this quote from Baldwin because it's a reminder that humans created the world as it is, which means it can be recreated, which is to say that the systems that we have right now are working the way they were designed to work. The health outcomes that we have right now are the outputs of a system that's working the way it was designed to work. The system is not great and it's not inevitable. We made the world we're living in and we can make it over. So as a few quick examples of people who are working toward making something over, I'll start with Art Place America, a creative placemaking foundation. They conducted field scans looking at art's role in many community sectors, safety, transportation, housing, food, health, everything. You can grab those field scans at this link if you want to take a screenshot of it. We'll also share the link later. And as you can see here, this website also pulls together themes from across all of that work, looking at how art can support and improve community development and community health. And that initiative grew into this one, Creating Healthy Communities. This initiative created all the things that you see here on the left. You can get all of them for free at this URL. And I'll highlight the white paper, which is pictured here. I worked on this with 10 other authors, including the now NEA director, Dr. Maria Rosario Jackson. We wanted to ask, what are the most urgent public health concerns for which arts and culture is an ideal partner, and how? So the paper goes through each of those 5 key issues that you see here on the right and shares evidence for why arts and culture are robust partners in addressing those issues. For each one, we give real-world examples of initiatives that are using the arts to address that issue. So you can snag that anytime for free. Related to that initiative, I made this framework with Dr. Jill Sankey at the University of Florida. We wanted to make it as easy as possible to draw connections between arts and culture and specific categories of health outcomes. So this is an interactive website. You can click on these categories in the blue and find related studies and reports about arts impacts on those categories. The Neuro Arts Blueprint is a partnership between the International Arts and Mind Lab at Johns Hopkins and the Aspen Institute. It's seeking to propel this field of neuro arts, basically the study of how arts and aesthetic experiences change the brain and body to promote health. And this document itself shares research about how arts affects our brains and bodies, describes examples of current work, offers a multi-year plan for developing this field. And this is a network that you can join and stay updated, attend webinars, etc., if you're interested in this field. And lastly, I just want you all to know about the Culture RX program in Massachusetts, which is linking healthcare providers across the state with arts and cultural organizations to increase arts access and improve health outcomes. You can see there's 12 cultural organizations, 20 plus healthcare providers, and more all the time. I led an evaluation of this last year, and you can snag our report for free at Mass Cultural Council or at my website that's here. And this program is an example of partnerships that are designed to apply what we know about arts health effects via these new innovative partnerships that help communities heal and thrive. So this has just been the quickest introduction to some intersections of arts and public health. And I'm delighted today to be here with folks in Rhode Island who are involved in another striking model of this work, which is not only a health and arts partnership, but a state health department partnering with a state arts agency, which as far as we know hasn't really been done before. So their process and results are really valuable to learn from. And I'll just state here quickly that sometimes you can hear about efforts like this and think like, okay, that's a great idea, but it's lofty and it's never going to work where I am or whatever. But I'm lucky to regularly get to help organizations turn ideas into effective efforts in their own communities with this work. And that's really our focus today, which is just, it's not just like, look what they did in Rhode Island. It's how can we help you envision something similar for your community and your region? So speaking though of what they did, I am going to stop sharing here and turn it over to Valerie Tetson.
Thank you, Tasha. Wow. That was great. Well, oh, well, oh, well, oh, well, let's make a place where the people are well, oh, 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 let's make a place where the people are well. Once upon a time ago, a rhythm and a rhyme ago, yesterday, today, tomorrow, every day, the people in the city of Providence, God's place, could feel the ancient feelings while they were standing on the land and working on the land of the Narragansett and the Nipmunk and the Wampanoag and the Pequot. And they could hear the rumbling, they could hear the song in the wind. Well, oh, well, let's make a place where the people are well. And it so happened that one of the people who heard the rumbling and the sound of the wind was sitting in a place called the State Council on the Arts. And she heard the song. Just as there was a man sitting in the Department of Health, and he heard the song and felt the rumbling, and they found themselves coming together in a conversation. Oh, well. Let's make a place where the people are well. They looked around at the community and they could see places where things were good, but they were very well aware of places where there was sickness, not just of the body, but also of the mind and of the spirit. And as they talked, they wondered, could we put out a call to the community? Could we send out a song, and would people come and sit around the table and around the fire? And could we dream a way to work together to make a place where all our people are well? And so they sent out the call, well, to the artists, and they came. Well, to the health providers, doctors and nurses and directors of programs, and they came and they sat around the table and they talked, and they found that each one there had a deep desire to bring wellness to the bodies and the minds and the spirits and the soul, not only of the people one by one, but to all who gathered. And they began to dream, what if every clinical setting had an artist as part of their rotation team? And an artist in health settings residency was birthed. What if we created a center where all people could come together from whatever their background and disciplines, and they began to dream, and they are dreaming that still. And they gather and they talk, they imagine, and bit by bit, they are working together to change the health, the wellness, the lives of the people, not just in the city, but all across the state. Well, let's make a place where the people are well. It is not the end. It is the beginning.
Aho.
Thank you so much, Valerie. And do I get the honor and privilege of welcoming the panelists onto the screen? So all these beautiful folks that Georgia introduced to you earlier will come and join us along with Valerie for a conversation here. And thank you so much for that, Valerie, the highlight of probably many of our afternoons. Thank you so much for sharing that vision with us. And she's given you an overarching idea of the dream of this work, and we're going to dig into some of the specifics and the practical on the ground details of this work. So I don't know if we will all be spotlighted together. That would be amazing. But I wanted to start our panel with a question to just kind of get some. Oh, thank you for sharing those polls. To just get us started in really general terms that would be relevant to people here, no matter what they selected in this poll that we see, no matter where they're coming from. What has this partnership that you all have created, and these multiple kinds of partnerships between organizations, made possible for you and your communities in Rhode Island? What are they, and what are they making possible for you all?
So this is Steven Boudreau, Chief Administrative Officer at the Rhode Island Department of Health, and one of the co-conveners and collaborators on our arts and health initiatives in the state. On a personal level, I can tell you that this work has positioned me to pull on the breadth of my experiences in both the arts and the public health arenas to develop something new and meaningful as I begin to carve my path in this field. For the agency itself, the Department of Health, we have these new rich relationships with the State Council on the Arts and other important individuals and organizations engaged in defining the field of arts and health. I'm coming to you today from the National Conference for Arts and Health, where I'm a board member, and we are having our national conference here in Baltimore. And the stories and songs and the beautiful work that you just heard from Valerie is really plentiful here where I am. And so I'm smitten, as always, with that kind of work. And you can imagine, as you listen to it, how it impacts individuals to move and act in this arena.
Thank you, Steven. Anyone else? What are these partnerships, and what are they making possible for you and your communities?
I would just add to what Steven said, and what Val said. The power of the partnerships is bringing us together and sharing our combined knowledge and putting that call out, as Val eloquently said, that by dreaming big together collectively, we can really think about possibilities that we might not be able to do on our own in our own agencies. So we can think differently, think outside the space, and then bring people together and learn, what the needs are of the community. So I think that's a really powerful piece.
I would, Gina, were you going to say something?
No, Miss Valerie, go ahead.
I was going to say, for me as an artist, the partnerships were really powerful because I learned so much from the folks who are coming from the clinical health setting, the community health setting. It really helped me articulate what I do, learn about what I do, and also learn about how to talk about it across disciplines. That was really important, and to understand where the barriers and the challenges are, as well as the easy synchronicities. That was really important for me.
Thank you for mentioning that. Sometimes in this work, it becomes really clear how the arts can benefit public health and community health, but the work is pretty reciprocal quite often. And I think it was in one of my slides, but I probably moved through it really quickly, that the partnership not only improves public health communications and public health efforts, but can also give artists a new way to have impact, a new way to think about their work, a lot of new creative inspiration, and new ways to organize their work and imagine it and work on it with communities. So thanks for mentioning that. Anyone else on that question of what these partnerships have done for you, or why you might want other people to consider creating these in their regions?
I'd love to pipe in. This is Gina from the City of Providence, Department of Art, Culture, and Tourism. We had a similar partnership at the city level with our Healthy Communities Office and our art office, and working with artists at this intersection. And one of the biggest learnings we've had is that the most radical, boundary pushing, social justice oriented work comes out of these partnerships, where we can have conversations with artists at the center around public safety, around the social determinants to health, and all of the underpinnings that go around what makes not only a person, but a community well or not, and all of the systems, as Tasha had pointed out to, that were and continue to work by design. We can push up against those systems in a different way when working at this intersection.
Thank you.
I'll just add a little bit more too. And I want to recognize Sherry Brown, who's on the call with us today, who really was the woman that Valerie was mentioning. It was not Anisa Raoof, it's Sherry Brown, who was the former director of education and health at Rhode Island State Council on the Arts, who retired recently. And we're just so grateful for her work with really pushing this whole project through and reaching out to the Department of Health in the first place. So I would also just say that because the groundwork for this work was laid pre-COVID, it allowed a lot of our healthcare providers to tap into the arts and a core of artists that were available for them to work with during the pandemic. And recently we had a meeting with the youth mental health hospital here called Bradley Hospital. And they had an artist in residence the entire time COVID was raging, working with some of the most seriously ill young people in the state at a time when their parents couldn't even come in to see them. So this work that started back in 2018, 2019 really laid the groundwork for those kinds of relationships to be in place in a crisis.
Yeah. And I really, I appreciate your answers to this initial question, because I think sometimes what it highlights is that, and what Gina mentioned as far as sometimes you can do this more effective work and more relevant work to the community by involving the artists or involving these partnerships. And sometimes it's just a matter of recognizing that these assets exist in your community. If you're in public health and you're in community health, it's not like you have to go create art like ex nihilo, like out of nothing. Like it's there in your community. It's a matter of imagining how do I make use of this asset that exists? And then as artists and arts agencies, of course, it's like these efforts are going on in your community, these efforts to reach communities, to educate, to raise awareness, to shift these social determinants of health. Those are ongoing in your community, and how can you be a part of them? How can we bridge these silos in order to make even more effective work? I want to jump into some practical things, but I also want to give you all a chance to, well, first of all, I want to highlight that there is a slide deck in the chat. You all can grab that file and get some information about some concrete terms of what's been going on in Rhode Island. But would one of you want to take a stab at just giving us a quick, concrete, what is this partnership? What are you doing? I know that you have an artist in residence with the State Department of Health, but give us a few quick concrete insights into what it is that you're doing, so folks can kind of wrap their heads around it as we move into the practical conversation.
Sure, I'm happy to jump in and invite others into the conversation as we go. Certainly Gina has a lot to add to this as well, because she's been doing this work for a little bit longer, I believe. So first and foremost, what it takes to get this work done is a group of really committed, enthusiastic individuals from across the arts, clinical, behavioral, and public health sectors. In Rhode Island, we brought those folks to the table very early in 2017 to really have the conversation that Valerie spoke about. I should say Valerie sang about. And we knew that we wanted to move the needle on the advancement of the integration of arts, art therapies, and health and well-being for Rhode Islanders specifically. And so the way that we landed on moving that needle was to begin the development of a state plan for the integration of arts and health. And so the team that was at the table, there were about 35 of us at the time, with the grand assistance of Sherry Lynn Brown, as Lynn mentioned. We wrote a plan that embeds 13 recommendations around policy, practice, and research that the State Department of Health and the State Council on the Arts would begin to move forward with the assistance of a steering committee. And those recommendations all focused on one or more of 5 specific areas. And so they were patient care, education, community well-being, healing environments, and caring for caregivers. And by building those focus areas and from the start, we were able to not just wrap in the clinical side of this, and the behavioral side, which is and in many ways more advanced than the public health side, but we were able to bring the public health teams into the conversation, and the artists were already a little bit further along because of the work that's happening on the clinical side. So I'll stop there and let my team jump in.
I'll just add
Thank
one quick
you.
thing before Gina jumps in, because Gina's going to talk about the work in the city. But I also think that it was, the three priorities, Stephen: policy, practice, and research. So all of this work was started with those three prongs. And so that was really important in terms of just how the whole thing got built out and continues to evolve.
Yeah, and the work is really focused. Thank you, Lynn, for surfacing that. The work is really focused in a different way in Rhode Island. Across the states, you see lots of programmatic work being unveiled. We're really more focused on designing the field. And so the policy, practice, and research pieces have become really important and continue to stay at the forefront of our ideas and thoughts as we progress this work.
Thank you, Gina.
Thank you all. Yeah, and Stephen, I just want to preface before I say anything that the State Arts and Health Plan has been a critical piece for the Department of Art, Culture, and Tourism at the city. Having the state stand behind this work helps us, and I think it creates a great policy level reciprocity across the city and state when we have policies that are aligned like that. And also everything I'm about to say, Val, jump in at any point, because we've been working together on all of these projects that I'm about to talk about. So feel free to jump in. Our trajectory started actually with our funding from Art Place America. When our department was under the direction of Lynn, we got this fantastic opportunity to be working in this cross-sector creative placemaking project centering community safety. And from that project, we started working with artist facilitators for the first time, and that was a term coined from funding that we received from the Kresge Foundation. And I'm mentioning the funders because I think it's important for the arts administrators and state arts agencies to understand that we got grant, like the play money. We didn't have the government money at first, and I think that's important in terms of just sharing the trajectory. But we were able to work with artists in facilitating communities to talk about really wicked questions related to social determinants of health. Before we had that language and before we were really thinking about that. That evolved into another round of creative placemaking dollars where we were working at the intersection of health, economic development, and food. So again, here is this health is at the center of these conversations, and we have artists facilitating these community processes. That then grew into a training series. And so in 2019, so this is pre-pandemic, we designed a program with artist facilitators, Val being one of them, in this team of artists who developed a program to train other artists in artist facilitation and also receive training in community health work. And so we learned from a trainer how to think about the core concepts of community health, really thinking about less about clinical settings, but more about community well-being and artists in place. So that was able to intersect with our public art program, where we embed artists in residency programs. So we've been able to kind of embed artists throughout by combining different policy initiatives around this intersection, around creative placemaking, and around our public art program, which now is able to utilize our general fund city public dollars. So in using external funding to kind of come up with pilot programs, we're now able to say, this is what it costs. This is what it means to move over time. This is how long we have to think. And we're able to kind of make the case internally because we had that external support.
Yeah.
And it was exciting to be a part of, this sort of evolution. It was like one thing was kind of leading to the next thing. There was a conversation that was happening both nationally, but also hyper locally. And so a lot of relationships were able to come together and grow over this time, which was really wonderful.
It's so important to mention, Valerie, and thank you, all of you, for your insights here, because I think, well, I just want to note for everybody else, not that you didn't hear this, but that, you know, when Steven was talking about the very beginnings of this, he didn't say that the health person went to the arts agency and they were like, here we have this full-fledged plan. Would you like to carry it out with us? And it didn't work the other way around either. It wasn't like an arts agency went to public health and they were like, we know what to do for our community. Would you like us to come do it with you? They got together and had the conversations around it and reached their decisions, reached their focal points that they were going to lean into in concert with one another in conversation, which I think is important to point out, because sometimes, like I mentioned earlier, it can seem like this kind of work is lofty, or like, where do we even begin? And I think we get into trouble when we think we have to have the whole thing outlined before we're even allowed to approach somebody as a potential partner. But I think that what you're seeing with these wonderful folks in Rhode Island is that they reached their they reached their ideas together. They got together. Maybe part of what the benefit was for them is that they didn't have some kind of fully worked out thing that then somebody else just had to agree to be involved with or not. They came together and then decided what to do together. So if you've been thinking about this in your community and you're like, oh man, I have no idea where we'd even begin with this, maybe that's ideal in a way, in that you're not coming to somebody else and being like, hey, hope you're along for the ride, but it's getting together and letting your different backgrounds and disciplines and experiences in your community inform something that's brand new. So thank you all for that insight. I also have so appreciated Gina's mention there. I hope that you all noticed that she talked about artists facilitating community conversations. And if you haven't ever been a part of something like that, just imagine doing a kind of town hall situation or a focus group, but the person who's leading it is a known community artist and not like just a random researcher who's like walking with a clipboard. You can imagine how that might feel pretty different and how people might share different things in that context than they would otherwise. That can make such a difference in the data that you get from your community and the ways that you connect with them and what you hear back from them. So we've mentioned a couple of times that this work can seem like it's a big hurdle, and obviously you all have been doing this for a while, but you know, just like anything innovative, this is going to take insights and experimenting and doing new things. So I'd love to hear some of your practical insights for our attendees today, just based on what you all have been through. So talking basics, you referred a little bit to funders. Thank you all for mentioning a few of those, but what does this kind of work cost? If we're just going to get really practical and tangible with it, what does it cost? And if you can go into a little bit more detail about where you are finding funding for it. And Gina, I know, mentioned that one kind of funder that led to another kind of funder, but let's talk a little bit more about that for the sake of our attendees who might be like, okay, how can I actually do this?
I would vote for hearing from Gina first, since they have, you know, dedicated funds.
Well, I think it's indicative of the fields just be operating differently as well. Artists are used to experimentation and to processes that might be messy. And there's funding sources attached to that process in a way that, from what I've learned about public health and sciences in general, is just a little bit, it's far more restricted. And so for partnerships that are forming, I think leaning into the arts agencies that are involved in order to find that external funding would be a helpful idea. I also want to say that this work is scalable. And so we kind of had a trajectory where we had a lot of external funding that over time, we were able to hone in on what the exact costs are for the artist facilitators. So I would say, if you're bringing in an artist facilitator, and again, Val, like jump in anytime, to come in and facilitate a process or be with you for the long term, I would advise that they are there with you to design the protocol, not just to come in and facilitate a session, but to be a part of designing the whole program, and to pay them more than a living wage for that experience, depending on what makes sense in your community. We try not to pay anyone anything less than $25 an hour, usually far higher than that whenever we can. And I think the work is also scalable. And if you're thinking about embedding an artist in a community, sort of in an artist residency, if they are working on a project design, or if they're working on a permanent artwork that has working at the intersection of health, you can kind of scale the project based on what the end product is, if that makes sense. But just to be more, more transparent, I believe our Art Place America funding, this has gone back a few years now. I think our overall project, and these are multi-year projects, was about 300,000. Our Sewing Place project from the Kresge Foundation was another 300,000. And then our Creative Community Health Worker Pilot Program was 100,000. That's all community partnerships involved, all the various programs involved, all of the artists involved. We always stipend people. So if you're working in community sessions, everybody should be paid for their time. We try to feed people at every meeting, offer childcare when possible. So those are all things that filter into the design of the project budget.
Lynn will say something, but I just want to echo that and thank Gina and the team for really thinking about it, because a lot of times artists are independent, so as are community workers. So when you're really thinking about the partnerships and the people who need to be at the table, yeah, it might be my job to come to this meeting because I'm interested in this work, but I'm not getting paid, unless there's consideration for that. I'm not on the clock getting paid for that unless, people are thinking about that. So that was really wonderful in those kinds of partnerships. And then there's the other piece a lot of times too, where you still have those other things where everybody's going to just come in because they're passionate about the work and they're going to do this. So it's managing that balance and paying attention to that.
And I'll just jump in from a different perspective in terms of just how the State Arts Agency and RIDO have leveraged resources that we already have. So one thing I want to kind of just, before I get into that, but is just say this is work that's been in the long game. This is not work that we just started. The community of Rhode Island and Providence and the State Arts Agency, the local arts agency have been laying the groundwork for this work for a very long time. I'll go all the way back 30 years. It's that Rhode Island State Council on the Arts has a teaching artist program that's very well respected, and those artists were working in the healthcare realm for a very long time. So leveraging the resources that you already have. And what we've been able to do with the State Arts Agency is just look at our grant making, look at our programs and say, how can we move some of the money that we're currently using for other programs into this arts and health program? So our arts and health program is fairly, our grant making is fairly modest. We're looking at ways of leveraging more dollars into it. Steven's also done an incredible job, particularly during the pandemic funding that came through, working artists into some of that work. And so we really have just sort of leveraged what we already have. And I think that that's just a place to start and start small. Steven, do you want to add to that?
I do, thank you. It's so important to recognize the work that's already been done at the local level and at the state art agencies, because you have history in policymaking and your arts and education program, which in many ways serves as a model for some of this work. And that's really important. And you have opportunities to spend your funding in ways that state agencies cannot. Separate from that, this is really new work for the public health side, these partnerships. And so we normally get our funding. 95% of the public health department's funding comes from federal agencies. So the FDA, the CDC, EPA, et cetera. We're really beginning to try to look at new funding sources. So arts and health work has really been attractive to private philanthropy. It's seen as sexy right now, and a window of opportunity is open. So I bring this up because I'm hopeful. I'm noticing that the predominant, most of you on the call are from state arts agencies. There are fewer people on the call from the public health side. And so what we've been doing from where I sit at the public health agency is really what I call case making. And I think that you're going to have to try to do that yourselves. And that's part of what this call is about, us helping you figure out how to make this kind of partnership work and how to begin to leverage the various funders that you're more used to working with than we are and get them to the table and join this conversation. So it's important to just recognize there are new things for our teams as there are for yours. And there's no real model.
Yeah, there's a lot of times in these conversations, people want something that's quote unquote scalable. And of course, this work is scalable at your local region, but there's also ways in which this work is emphatically and inherently hyper-local, because the work that you can do depends on the cultures of your community, the cultural assets in your community, et cetera. And so it's going to have to look different in different places. What we can learn from each other is processes, though, right? We can learn ways of approaching it. We can get ideas. We can start with seeds of things and be like, what would that look like in my community with my different set of cultural assets, with my different kind of community issues or priorities or concerns. So thank you for highlighting that. And when we talked as a group last month, I'll tell you all that we mentioned that what Rhode Island has done has taken a really, really long time. It's so important for all of us to sort of like ground ourselves in the actual kind of time that this takes, so that we don't do something for 6 months and we don't see it like blossom into something beautiful and think that we're failures, right? Like this, if you can ground yourself in the practicality of it, you can get a little bit further. But also recognizing that people who did this first, it took them longer because there was no example to point to. And fundamentally, the folks on this call who can point to examples like Rhode Island, who can point to other examples like the ones that were in my slide deck, or the ones that you'll get in a resource from NASAA, that's already going to put your starting block ahead of theirs. So yes, these things take time, but no, you don't have to start from scratch like these people did. And that's why they're here, to try to give you what tools and ideas that they can, to give you some of these resources that are getting dropped in the chat, so that you can start with some of that oomph and energy behind you. So anything else to add about funding for you all? I noticed a couple things in the chat if you want to respond to that.
I just wanted to add, Tasha, that one of the things is that the priorities at RISCA, allowing staff to be able to work on these projects is one way to just even seed it. There was already just giving staff time to say, okay, you have an idea, let's run with it. Let's think about it and give space for that and see where it goes. So making that as a commitment, which was at RISCA as well as at RIDO, there's a lot of passion that goes for the interest to even follow this to begin with. But I think that's helpful in a way to start small. And then, as Lynn highlighted, at RISCA, we already had these teaching artists and grant programs. So how could we change them a little to pilot something small to shift the conversation a little in how we were funding and what we were looking at? So those were small changes, that we could do to start as part of the work.
Yeah, and the path that we're carving is really about helping public health programmatic teams understand the value of having an artist embedded in their work as they try to solve really hard public health problems. That's not a hard case to make. And so it's easy from that perspective, once you've done that work, to begin to talk to the teams about how to build this work into their funding opportunities, their grant applications, as they begin to renew the work that they're doing and build new channels of work. So building it in from the start is what we're doing on the public health side.
And if I could just add that we oftentimes think of artists having survival jobs in the hospitality sector. So every artist is also magically a bartender, which happens, but many artists are also yoga teachers and massage therapists and doing elder care. They're also CNAs. I mean, there are artists that are already working in clinical health and community health settings, and thinking about cross-sector funding around the intersection with workforce development, around, there's so many different types of pools and ways to fund this through different, through economic opportunity dollars, through workforce development, through small business loans. I mean, there's so many ways to kind of pull if you have arts and health at the center. So just wanted to throw that out as a.
Yeah, thank you. And Steven mentioned earlier the idea of case making, and there's great conversation in the chat to look at here about yes, things can cost a lot of money, but you can also start with a little bit of money. And some of that is part of your case making. Like for any of my entrepreneurs here or whatever, there's the idea of making a minimum viable product, right? The translation of that might be what's the smallest version of this that you could do in your community in order to say, look what we did, look at the outcomes we got here. And that becomes something that you could take back to a funder to say, okay, would you double that amount the next time, or would you give us a much larger grant for a larger version of this the next year? So that's all part of it, being imaginative, letting the imaginative nature of your work, the creative nature, the innovative nature of your work also apply to the way that you think about this as far as a business procedure, as far as grant writing and obtaining grants. And Steven, I don't want to put you on the spot, but you have mentioned before the need to get a little bit more creative about funding, and you kind of spoke to this a little bit earlier, but is there anything that you want to add about funding having to come from different areas?
I mean, I think it's I'm not sure what I can add. We're learning as we go because we're speaking to new types of funders. I think one of the things that we're looking to do on the public health side is employ someone who's adept at that. So a grant developer who can help us have those conversations. And I'm confident that the people in the state arts agencies can help us do some of that work as well, because you're used to talking to these folks, right? So there's a learning curve for us. The FDA, the EPA, the World Health Organization, they've all got arts and health on their agendas now, and so the funding will come more naturally to us through those streams. But we need to braid it together with the private philanthropy in order for, I think, it to be effective, robust, and to come from a place of passion.
Thank you. I have a question that I didn't include or didn't prepare you all for, but I wondered if, speaking to that idea of like minimum viable product, or kind of trying something and making a case for it later, is there an example, maybe especially Gina or Valerie, that you could, or an idea that you could give us of how something that you've done that maybe was a bit more expensive kind of started from a seed earlier on? Anything concrete like that that you could share?
Well, it seemed, Gina, you'll be able to speak to this better, but wouldn't you say that the whole idea of creating the artistic facilitation came out of that work that we were doing prior, which was, the very local around the safety. And we found that we loved working with the artist facilitators, and that involved, they were facilitating people from a housing place, an art center, all these different organizations. And we could see, I think you all could see as well, that, wow, it really was wonderful to have this artistic facilitation. So how can we take this little piece of what got funded out of that and then make it bigger? So then we had 7 people, 10, how many people were in that facilitation group?
There were 3 of you designing the curriculum, and then 5, the cohort of 5. I'll throw the job description. I'm going to throw the call to artists in the chat so everyone can see what that framework looked like. So yeah, to highlight what Valerie just laid out, we went from the artist facilitators being one piece of a very large creative placemaking project over multiple years, to then taking artist facilitation as the heart of the design process for a second creative placemaking, to then taking artist facilitation, working with community health work in one comprehensive training, to train 5 artists with a very small budget of only $5,000 each to do a very short residency in a community-based organization. So we kind of funneled from big we went inward into the process, and now we have something that we can scale that started at 5,000 and now is in our current work is at about 25,000. And we're imagining to go up to 60. So we can continue to scale the work, and that can ebb and flow, because we never know, you never know when your grant opportunities are going to just not be there anymore, or when your general fund is not going to look the same. And so it's good to just have a variety of options. But I threw the call to artists in the chat there, and a little bit above that, I threw in the final curriculum that Valerie and Vadik Kumba and Laura Brown-Lavoie developed. It's a 27-hour curriculum for artists to facilitate community processes, and it's open source. So anyone on this call is welcome to pick that up. They wrote it so that anyone could pick it up. Though I will plug Valerie, should you want an artist to come to your town, I highly recommend Vatic, Val, and Laura to come and do that with you.
Yeah, thank you. Always good to have a spark of a suggestion. Lynn, did you have something to add? Oh, you're muted.
It's just something that's on my mind about this art and work. So the arts and health work, the arts and all these other integrations that we've all been involved in. And I think the thing that's remarkable about the relationship between the State Arts Council, which I'll take no credit for. I was not here when this work was happening. It's all Steven and Sherry and Anisa. The thing that I think as artists, as arts administrators, as State Arts Council representatives, as local arts agencies, oftentimes we want to own things too much, or feel we're all working from such a place of scarcity so much that oftentimes it's hard when we get into these partnerships, we want to make sure we get credit. But the wonderful thing about this is that, the Department of Health and under Steven's leadership has really just taken this and run with it and found ways to incorporate artists and art making and the whole artistic practice into the work that they're doing. And I think Steven, has said it's still pretty nascent, but we aren't trying to own that. We aren't trying to control that. We aren't trying to be in it with Steven. Steven is just doing it. And there are places where we're collaborating and we're having conversations and we want to move forward together. But there's also this whole other piece that's just happening through the Department of Health that's just living its own life, and it's supporting artists, and the artists are benefiting from it. The folks in the healthcare situations are benefiting from it. The practitioners are benefiting from the artists being together, but we're not owning and controlling it. So I think that's really important.
Thank you. Well, we are careening into my last couple of questions for you all. But again, kind of like with that practicalities theme, what are some tools or tips or helps that have supported you all in doing this work? However superficial or small it might seem, however large it might seem, what are some tips and tools that you would share with attendees today?
So I hate to keep jumping in first, but having been there from the start, I'll just say that it's important to think about this work from the networking perspective. First of all, it eliminates hierarchy, which is just not going to suit this kind of work. But secondly, it's a way of recognizing that you can get out into the community and find out where this work is already happening, because I guarantee you it is. And then connecting those dots between what's been happening and best practice for first steps moving forward, and building a network of interested parties, make it clear from the onset that participation in this work with their teams moving forward, if they want to participate in the designing of the field, can be done in ways and researched in ways and measured in ways that help lift up and support the work we're doing to design the field. So to me, the most important thing you can do from the onset is making those connections. It's all about connectivity and collaboration. And as Lynn said, recognizing you can't hold it too close to your chest. There's work that lives in the state art agency's portfolio, as well as work that lives in ours. And then just naturally, there's sort of this third entity that can come from the work, such as ideas like a Center for Arts and Health, and what would that look like, or a research hub, and what would that look like? So bigger, broader things that neither of the agencies would necessarily own, but might help resource.
And that also means casting a wide net when you're talking about the networking, right? Because in many places, our organizations are not as diverse as our communities. So it's always a question of who's not here, and how do we open that up? Because of the things that you actually put in there, Tasha, in your first question, which is like, who's missing? The cultural knowledge that might not be present, right? So because in certain in living communities. People are making art and they're taking care of themselves the way they do and might not fit into our prescribed idea of what is art making and what is health making. So constantly opening that up and drawing the circle wider.
Thank you. Any other tools or helps or even tiny suggestions that you would give if you were kind of coaching or working with folks that are on the call?
I'll just add, well, one, I want to thank Steven and Sherry because I'm new to this and I'm learning a lot from them and from the community. So that I'm very grateful for that. I'm also grateful for, the artists, our network of, as Steven and Val eloquently said, the resources that all of that they bring together. And then I can't ignore NASAA. Nationally, we have the resources of what's happening across states, just like this webinar, but even early on, just the work that they've done to help support sharing what other states are doing. I know Lisa from New Hampshire is on the call and they've done a lot of work around arts and health. So we're very reciprocal in trying to share the information that we have or what we don't know, what we're doing, what works, and I think that's really helpful. We also restructured our grant program, our Project Grants and Healthcare grant program this year, and we put together a working group of healthcare. Val was on it, Lisa from New Hampshire, people from the Rhode Island Department of Health to rethink what our grant program looks like. And so again, leaning in on what the expertise of others helps inform the work that we're doing and always rethinking and retooling that. So that's really important.
And I'll just add one other thing. I think in terms of when we're talking about integrating arts into other fields, that it's really important that we understand the language of the field that we're working with. And then we're able to, in our moments of having opportunities to communicate with the healthcare field or the health field in general, the public health field as well, is that we're taking the lead from the folks that work in those fields and we're not we're listening to the way those fields are communicating with each other as a field. And we're then also speaking that language with that field. So Steven's been thinking about that a lot too, just in terms of like, how do we communicate to the new folks that are coming into the agency? We want to make sure that we're being, very organized and brief, and we're using metrics and data, and that we're talking the same language, because there's always that translation piece that comes into play when we're doing these collaborations.
Yeah. And thank you all. I think what I'm hearing is part of what we all mentioned earlier, as far as recognizing that there are assets already in your community. There's already ways to work together. And again, if you don't know all of the ins and outs of exactly what to do and exactly how you'll what language you'll use to describe it, exactly how are you going to measure it, how are you going to prove that it's useful in certain specific ways, you don't have to know all of that before the world gives you permission to enter into initial partnerships to begin exploring this work. And if you wait for that, you will never do it, right? The partnership works with the idea that you recognize there could be value in that. And then you start having the conversations and allow things to develop from there. What you don't know isn't a sign of your failure or your inadequacy. It's a sign of the value of a partner, right? And your partners are going to know the things that you don't know. That's the value of collaboration and getting together. So as our final question before the Q&A time, I just wanted to ask you all what you see as being next in this work. What are you doing next in Rhode Island? Or, I know that Steven has mentioned growing this as a field. What do you see as the next steps in that? And if there's anything that you want to invite the attendees into as far as things that they can continue to follow up on or be part of, feel free to mention those too. But yeah, what's coming up next?
Sure, and quickly, just because I saw the question pop up about the short film that we developed around this work, it does live on the Department of Health's website, and that's in the resource document that has been put into the chat. So awesome. You can find it there. The some of the buzzwords in public health right now, I think across the world right now, really are employee wellness, resilience, and workforce development. And these are new connection points for making the case for this work. So finding inroads through that work and those frameworks is what I'm doing. That's what's next, really developing a strategic plan around how to not just continue making the case, but embed the work in ways that public health teams understand. So at the public health department, we like to say that we issue your birth certificate and your death certificate, and we have our hands in everything in between. So maternal and child health, sudden infant death syndrome, dental, name it, we're there. And it makes sense to me, and it's making more sense on a daily basis to my staff about how important and relevant or different the work can be done when an artist is at the table with us doing it.
Thank you. Anyone else? What's next for your work, or what's next for your specific projects, or the people that you're working with, the artists you're working with, the communities you're working with?
I'll just mention, I had brought it up before about our project grants in healthcare, that we're restructuring them because they were limited to healthcare organizations being the applicant and the projects with an artist happening in the hospital. And thinking about the field in general is now expanding. It'll be an arts and health grant, and it will include public health as well as the arts engagement with artists happening in health-based or community spaces, and recognizing that this work is happening, all over, and responding to that with changing our grant program, which was originally created with a certain intent at the time to support the arts and health initiative, but knowing, as you move forward, you rethink and reevaluate what we're doing. So that's important work that we're doing that will launch in January. So.
Personally, one of the things that I do related to what Anisa just said is, for years, I've been telling stories in the hospital at the Tomorrow Fund Clinic. And this partnership has really helped inform how that works, or the conversations, I would say, kind of shifting from performative aspects of myself as an artist to really what it means to sit bedside with folks and families, and what happens in storytelling in that. And with our Rhode Island Black Storytellers, we continue to develop a program we call Community Flavors, which is this is our time where we invite the community to come together, and we sit around the table and we share food and we share stories. We do guided storytelling together. And we started that like in 2015 when we invited an Indigenous man who is both an Indigenous healer and a medical doctor, Louis Mel Madrona, to come and talk about storytelling for healing for individuals and community. And he said, if you want your community to be well, you just need to gather regularly and share food and stories. So, we've been working to do that.
City side, our next phase, we're really looking at building and supporting cohorts of artists working at this intersection. And so we have a current project through support from the National League of Cities and working at the intersection of art, community health, and housing. So we're going to be embedding artists and community health workers together in different public housing complexes. First to build permanent artworks with residents, and then to do workshops with residents where community health workers are present, because we've learned, anecdotally, that folks are more comfortable talking about their health needs in an artistic space than they are with somebody with a clipboard, as somebody said. So we're just kind of really focused on creating the container to support artists at this work, and then creating the spaces where it can happen. And then because we're the government agency, we try to walk away. So that's what we're doing right now.
Thank you all so much. And we are right on time to move into our Q&A. So I get to turn things over to Miss Georgia, who can join us and help offer some questions to the panel to answer from the audience. Thank you all for submitting questions, and thank you, Georgia.
Absolutely. Thank you all. That was such a rich discussion. I think our first question comes from Sunil Iyengar, who says or asks, would love to hear any common cause you or others have been able to find with other types of non-arts community organizations or funders supporting greater public attention to the social determinants of health.
Leave it to Sunil. So if I understand the question, this building of partnerships and reaching out to others outside of the public health sector is something that we do quite regularly, and because we have to in public health. Because we have our hands in so much, so food protection, education, agriculture, drinking water, we have to naturally reach out across the table and invite our partners from other sectors in to talk about social and environmental determinants of health and how together we can build partnerships to sort of move the needle in that area. So we have a public health academic working group, which is a partnership with academia, where we invite different sectors in to discuss a specific topic or question that might lead to the intersection of some innovative partnering around moving the needle on determinants of health. And so that's just one tool that we use.
And if I can throw in, I'm so sorry, Lynn, go ahead.
I was going to ask Steven if you wanted to talk a little bit about the health equity zones, because there are multiple partners there as well, and community development partners.
Sure. So the health equity zones is an initiative that started at the Department of Health, I want to say maybe close to 5 years ago. And so we have braided together funding from the CDC and other non-atypical sort of funders at the agency. We wanted to take health and well-being to the people in the community and fund them to do the work of identifying what is important to them, where they sit, where they live, where they play. And so we have divided the state into geographical zones known as health equity zones. We've employed a backbone agencies. Sometimes that's a hospital, sometimes it's a nonprofit organization. And together they go out into the community with us and pull together stakeholders who are interested in moving the needle on socioeconomic and environmental determinants of health in their neighborhoods and communities. And we sit with them and identify ways in which we could take that braided funding and fund the work that they are doing. And oftentimes, hopefully soon, always, there are artists involved in those, in those community teams.
I was going to say earlier that if you, of course, in Rhode Island, they are inviting artists into these conversations, but in your communities, there are people who are talking about the social determinants of health and trying to move the needle on this. And maybe your public health and community health folks don't realize that they should or could be inviting artists to that. But as arts agencies, as artists, you can show up to those. They're often public meetings. And even if you're not given an opportunity to contribute to the conversation, and I hope that you are, it's going to give you different ideas as artists, as arts organizations, of what you could be doing in your community or what you could propose. So just that's an easy way to try to insert yourself into the conversation if you're trying to think of next steps.
Yeah, and we're super interested in starting happy hour conversations where we can help you bridge those conversations. Through an online conversation. So just building a collaborative sort of community of individuals who are interested in learning how to do this work.
I'm going to give a little push from my former employer, LISC, which is doing a lot of work across the country in health equity and health equity zone kind of planning. They're one of the partners in this project in Rhode Island. But if our state arts agencies or our local arts agencies are looking for partners in that work, there may be a LISC office in your state, and that would be a good partner.
Yeah, RIBS did a partnership with LISC, and then LISC also, we were doing storytelling and food stuff in different communities around the state. And they also then leveraged monies that came from Tufts Medical. So I'll just put that out there for what that's worth.
If I could pipe in on the social determinant question that was asked, just as another project that had happened with the city, you know, in 2020, we had so much public racial reckoning happening and a lot of examinations on public budgets in Providence. There was a really concerted effort to re-examine the public safety budget. And so our office and our Healthy Communities Office joined forces in that very public examination in order to, you know, be a part of the conversation, but worked with artists in doing so. And so some of those same artists that we had worked with as artist facilitators were brought on to engage community on sort of imagining a different world, and in doing that world building in terms of thinking about public safety as public health and what that would mean. So I just want to support Vadik Kumba and Shay Rivera Rios's project. I'm going to throw that in the chat. It's a video series, and it's futurist storytelling that reimagines things differently. So when we're thinking about the social determinants of health, there's so much dismantling that needs to happen in order to rebuild, but there's so much visioning that also needs to happen in order to rebuild. And I think artists are obviously our champions in imagining the world that we want to be manifesting. And so projects designed around a world where social determinants don't exist in the way they do now are a way to enter into this work.
Excellent. Thank you, Gina, and thank you, everyone. Our next question comes from Norwood Creech, who asks, when sharing the work of arts in health, was there a common denominator or theme that inspired a aha response that opened the door to greater community engagement or engagement from the community?
So I think that there's just this recognition once it really is about just beginning the conversation and putting it on the table, right? Because once you do that, the aha moment is just this recognition that creativity and well-being have been connected throughout history, right? It's disconnections that have occurred over time, particularly in the United States, and the way that we fund you know, the clinical setting versus, you know, social services. And so, yeah, it's really just about recognizing that and having a conversation about the connections that need to be rebuilt. And when that conversation is had, everything begins to make sense to people.
I would just add, it's not necessarily an aha moment, but something that Stephen and I are reminded a lot in our work. We have an artist in residence program that is a partnership between RISCA and the Rhode Island Department of Health. The graphic novel cookbook that was shown was for our first artist in residence, where she was embedded at the Rhode Island Department of Health with the idea of that if you put an artist within a state, you know, agency, that they would foster creative-based approaches and encourage maybe innovation around specific health goals. Our second artist in residence is at the Office of Health and Human Services. And one thing that we're reminded in the application process and in the residency in general is that we're really focused on process and not product. And we're always having to sort of shift and think about that. Even when the artists applied for the residency, they were, you know, I got calls, what's the project? What do I need to do? And it's like, well, we don't, you know, and what's the art form? It's like, well, there's no defined art form. There's no specific project. The idea is we're planting this artist within the space to come together to think about what they could do together. And with it, there's pretty exciting things that can happen. There's a lot of also stillness and sort of settling because you don't know what's going to happen. You're working within a state arts agency. You're working, you know, not sure what they want, and they're not sure, you know, they're waiting for you to just do the thing, the magic thing that's going to end, and they can say what that thing is. But that process is the part that hopefully will change and transform things. So it's still interesting how we articulate, how we measure what the impact of it. We know that, you know, we know that it's magic and that there's things happening and will change cultures, but it's but we're having to talk about it a lot, which is exciting, and thinking about that. I know it came up, I think maybe at the Creative Health and Communities convening about how you measure and think about, but process over product is just important. So.
I had an aha moment when we were gathering ourselves together, you know, health practitioners, doctors, nurses, high level, you know, people. And I realized that I sometimes feel as if people in the health field are more privileged than I, and are, you know, smarter, have more power, have all, you know, all of those things that kind of get trapped up in that. But in one of our exercises, Tasha, you mentioned this, I think too, all of a sudden, not all of a sudden, but as I was meeting these health practitioners, they all had an arts practice, you know, and that was an aha for me, and for I think those of us in the room to just see how vital that is, you know, even as they're thinking clinically, it's like, no, but to relax, I play the piano or I make jewelry, you know, I was like, oh. So finding that kind of common ground space was really beautiful.
Absolutely.
And that's really that part of, you know, the well-being as well as the absence of disease. Like if you're just focused on how do I get somebody better or react to a pain or a harm that's happened, you're not thinking about what it takes to thrive. But thriving has never been a bonus. It's a fundamental part of health. It's just a societal decision to make it seem like it's a bonus. But yeah, Valerie, what you're talking about there is that people kind of like dismiss or kind of downplay the things that they do to help themselves thrive or heal or feel a little bit better because it's not part of this typical understanding of health. But
then we could talk about it, right? Then we could talk about it and say, well, why? Well, it makes me feel good, or I do that to de-stress, or
yes.
So in the 3 minutes that we have left, I want to pose one final question from Ryan Stubbs of NASAA. Any thoughts on how public health data can help guide arts and health programming? Any particularly useful data points, or are there gaps in the data that might help?
I'm looking at Sherry smiling up there. We got to gather the data. Bless you.
Yeah. Data on the public health side is a difficult thing. There's an abundance of it, right? But we often find ourselves having to collect it in different ways as we begin these new sort of ventures to ensure that we're encapsulating all of the things that we need. So I think it's there are more than 60 or 80 different surveys at the Department of Health that we collect data on. So so we haven't done this work yet, but I think it is important that we probably do soon, is an inventory of just what data points we have to really help understand how that might inform this work. And that needs to be done probably at the national level as well. But the public health departments, in Rhode Island, we're a little bit lucky because we're one of only 3 states that has only one health department. All other states have county level health departments. And the reason I say we're lucky is because we get all the data, right? It belongs to us. So there's that. There's some work to be done in that area though. And it's true of any new work that we take on. So racism, social justice, sexual orientation, and gender identity, these have all been added to the public health agenda. And we're struggling right now with identifying the ways in which we can and should be collecting data around those topics and issues. And I'm happy to have a seat at that table right now because I can ensure that it's informing this work too as we think about it.
There are, I could say so much about this, but yes, I think that having an inventory of that, like that, Stephen, would be amazing. But then also in your, I was trying to draft some questions in there, like in your local communities, what are the urgent health concerns? That's what we tried to look at with the white paper. What are the urgent public health concerns for which arts and culture could be a robust partner? But like, what's urgent in your community? Where is there a dearth of resources? Whose concerns have gone underheard or unheard that you could help amplify or elevate or help address? what health concerns don't tend to have ready access to treatment for them because there's not insurance like parity or things like that that you could step into. And of course, if it's interesting to you all, we also are looking at a really a problem with youth mental health right now and a dearth of resources there. So that's an intuitive place to start for a lot of arts organizations right now across the country as well.
And partnering with your health agency on understanding what the health disparities and where the health inequities are in your communities is such a great starting point for that and for finding that information and just surfacing it.
Absolutely. Well, thank you all so much again for this discussion. It's been truly, truly wonderful today. I want to hand this back over to Ryan, who will close us out.
Great, thanks everyone. Just really want to say thanks to all of our presenters and speakers and everyone who joined today. Just really inspiring and practical, which is the sweet spot. And I'm just sharing one last slide here with links to the health, arts and health resources, many of which have been shared within the chat already, but here are those resources, and we've also shared that within the chat. So please take a second to download that if you would like. We'll also be sharing this PDF along with the recording and slides in the coming weeks. So stay tuned for that. And also just wanted to say a special thanks to Georgia Gempler at the National League of Cities for all of her collaborative work in uplifting the value of the arts and community well-being to the NLC network. And a special thanks to my colleague Declan Wicks, whose efforts have been invaluable in this work. And with that, we'll sign off. Many thanks. And I think we're all inspired moving forward to do more of this in our communities. Thanks all and take care.